Hello, everybody. Thanks for joining us today. I'm Dr. Angela Mattke, and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. Twice per month, I host this show where we discuss common pediatric health topics with top experts from Mayo Clinic Children's Center in Rochester, Minnesota. Today, we are discussing pediatric anesthesia, and is it safe for your child? We are honored to have the director of the Mayo Clinic Children's Center, Dr. Randall Flick, as our guest today. In addition to leading children's health at Mayo Clinic, he is a pediatrician and anesthesiologist who cares for children in the operating room and intensive care unit. Dr. Flick is the current president for the Society of Pediatric Anesthesia. He is the former chair of the FDA Advisory Committee on Anesthetics and a respected researcher in the effects of anesthesia on the developing brain. Please join the conversation today by sending in your questions and comments under the Facebook Live video stream, and we will try to answer them today during our live broadcast. Dr. Flick, it is an honor to have you here today. Thanks for taking the time to join us.
Oh, thank you, Angie. It's my pleasure to be here. This should be fun.
This should be fun and provide good information for families about anesthesia that may be facing this with their child with a surgery or some type of procedure.
Yeah. Happy to provide whatever I can.
Awesome. So tell us a little bit, how did you get interested in pediatric anesthesia? What was your journey like?
Well, it's a little bit unusual. So I'm not sure you know this, but I was actually a nurse before I went to medical school, and I was an emergency room nurse, and I became interested in really sick children. So I went to medical school and looked for the way to take care of the most really sick kids, and that was through anesthesia and critical care. So I trained in pediatrics and anesthesia, and that's the story.
And it's a long journey, that training that you do.
It is
many years.
It was, but it was well worth it.
Yeah, absolutely. So I think there's a lot of misconceptions about what actually anesthesia is and what occurs during it. Can you help describe to us what anesthesia truly is and how it works?
Well, you're starting with the hard question.
I come out hard. Yeah.
So we really honestly don't know how anesthesia works. We know that anesthetics work on the brain, and they work on a couple of receptors. Receptors are like a lock, and the anesthetic agent is like the key that goes in the lock. And there are a couple of different of these receptors that the anesthetics work on. But how they actually interact with that receptor and how they affect the brain is really not known. So essentially all the anesthetics that we use today work on two receptors. There are a couple exceptions to that, but they interact with the brain and interrupt the way the brain sends signals from one portion of the brain to another. And so that is what really interrupts consciousness. Okay.
There's, I assume, a lot of different types of anesthesia that can be performed. As you mentioned, there was many different types of anesthetics that you use. Can you describe some of those different types that you use in children?
Yeah, so the types of anesthesia we use in children are really no different than the types of anesthesia we use in adults. We may use different doses or somewhat different drugs, but most of the things we do in children are very similar to what we do in adults. And when you think of anesthesia, you think of kind of a couple different major categories. One would be what we call local or regional anesthesia. That's when we inject medicines like Novocaine in a tooth. That's an anesthetic. Or regional anesthesia, and most of your viewers probably have heard of epidural anesthesia. For childbirth, we use epidural anesthesia for a variety of things, and we use it in children, and that's where we inject another medicine similar to Novocaine that blocks nerve impulses from a portion of the body, either a very specific portion of the body or a wide part of the body, like your lower half of your body. And then there's sedation and general anesthesia. And sedation and general anesthesia are what most people think of as anesthesia. And that's what we were talking about when we talk about how anesthesia works. Sedation is when we give enough medicine so you're kind of awake and kind of asleep, and you're cooperative, especially in the case of a child. A child is cooperative enough to have a procedure. These are generally relatively minor procedures. And to be honest with you, Angie, sedation is usually not the choice that we use in children, often because sedation is a continuum, and sedation often kind of continues on into general anesthesia. And general anesthesia is when we have someone unconscious and not responsive. And we use a variety of different medications to produce general anesthesia. When we think of general anesthesia, we think of the various goals that we try and achieve. So when we induce general anesthesia, we want the patient to be unconscious. Mm-hmm. We also want them to not remember, right, and that we call amnesia. We want the child or the adult to be pain-free. Mm-hmm. And often we want that person to be relaxed, so their muscles to be relaxed. Mm-hmm. So the various medicines that we use, the cocktail, if you will, is we sort of come up with based on the desired effect, how much pain relief we want versus unconsciousness, mm-hmm, versus muscle relaxation, those sorts of things. Okay. So that's a complicated answer.
It's a complicated field, so I think you did a great job summarizing that. As a parent, so I've had my children undergo anesthesia, mm-hmm, my son recently as well, and there's a lot of concerns that come with that as a parent, and some of those common concerns I hear is it safe? Will my child feel pain? Those kind of things. Will my child remember it? So let's start with the easier ones, and not the safety part. We'll save that for later. Will your child remember that? And you mentioned the pain, how you're trying to treat the pain during it. Will they have some pain?
Well, so again, these are not always straightforward questions. Will a child remember anesthesia? The likelihood of that is very, very low. Mm-hmm. And all of these things, one of the wonderful things about pediatric anesthesia is if you ask about a child, you're asking about many things. Mm-hmm. You're talking about a neonate or a 17-year-old, and they're very different things. Yeah. So neonates typically don't remember things. Mm-hmm. They don't have the capacity to have that recall. So mm-hmm, none of us really remember what happened to us when we were very young. Mm-hmm. But I think the easy answer to that question is no. Your child won't remember what occurs under anesthesia. There are very rare exceptions mm-hmm, to that. And it does happen, but it's really quite unusual.
Okay. What about the pain? Will they have pain or remember having pain?
Well, that's a good question. Mm-hmm. So those are different things. Mm-hmm. So if your child had pain under anesthesia, one could say, what's the impact of that mm-hmm, if they don't remember it?
Absolutely.
Again, the easy answer to that question is no, your child won't feel pain and would be very unlikely to remember it if they do feel pain. Remember, to feel pain is a question that can be broken down into, is one aware of pain? Mm-hmm. And so from the standpoint of anesthesia, we want to make sure that a child is not aware of pain. Will they feel pain? In other words, would their blood pressure rise mm-hmm, or their heart rate go up because something painful is happening? Yes, that may occur, but they won't have consciousness or awareness of that.
That's a very good point. During anesthesia or surgeries or even some type of complex procedures, there's a lot of people that are involved in a lot of monitoring that goes on. Can you explain to parents what you're doing with monitoring and what you're watching for?
Well, the most important monitor that we have for anesthesia is an anesthesiologist, mm-hmm, someone who understands how to care for children under anesthesia, how to prepare an anesthetic, how to conduct an anesthetic, and how to avoid complications that go along with anesthesia, and more importantly, how to rescue someone if they do have a complication. We work in teams in anesthesia, and anesthesia was the field that sort of invented safety in medicine. So anesthesia is all about safety, and so sometimes your anesthesiologist may be working with a nurse anesthetist. Sometimes they may be working as the direct provider of anesthesia. But most of the time at Mayo Clinic, in fact, all of the time at Mayo Clinic, we work as a team. So an anesthesiologist with a nurse anesthetist or an anesthesia resident or fellow.
Absolutely. Well, you've alluded to earlier in the beginning about us not understanding exactly how anesthesia works. And so that kind of gets into our next topic about how do we know if it's safe? How do we know it's not going to affect the development of a child? And we have a great audience question about that. And they're asking about what anesthesia does or how does it affect the development of brain in children, especially during a critical period of their brain development.
Right, and that's the area of our research, and we have a research team here at Mayo Clinic that I'm a member of that has been looking at this problem now for about 10 years. So about 20 years ago, there was a study done in St. Louis that looked at the effect of anesthetics on animal brains. And they found that anesthetics caused injury to animal brains that was a permanent injury and affected the way those animals were able to behave and their memory and those sorts of things. And so we began to look at that problem here about 10 years ago. The answer to the question is not yet clear. We've been looking at this, as I said, for 10 years. What we know is that anesthetics, single brief anesthetics, are very unlikely to have any impact on subsequent brain development. However, repeated anesthetics, there still is uncertainty about that. And so we're about to publish a major study that will come out in the next couple of months that will, to some extent, or will shed light on that question, but will not answer the question fully. I think we still don't know. The FDA has been engaged in this question. A lot of research groups around the world are engaged in answering this question. But I think for parents, you should be reassured that if there is an effect on the brain, again, it's only with repeated exposures in young children, let's say children less than age 3. And the effects, if there are any effects, and we still don't know, those effects are really very modest and would be very difficult to detect unless you did very specific testing to the brain.
Okay. What are the things that have been proposed that how it affects the brain? What kind of things could potentially be affected, especially in the animal studies?
Well, so in animals, what we know, so let's back up just a little bit, Angie, and when the brain develops, the brain grows very rapidly late in gestation, before the child is born, and in the first, let's say, 3 years of life. The brain goes very rapidly, and some brain cells die off. In fact, many brain cells die as connections are made or not made. And if connections aren't made, those brain cells that don't make effective connections die off. But when a child or when an animal is exposed to an anesthetic agent, the number of brain cells that die off is much greater and affects a much wider parts of the brain, or more parts of the brain. And we know that that affects their ability to remember. So if we take, let's say, a rat and have them do a maze, the animals that were exposed to anesthesia aren't able to do that maze as well as animals that weren't. Or if we look at monkeys, and we look at the way monkeys perform on tests of intelligence, they perform less well. Specifically, they have a harder time training to do tasks, and that persists through the life of the animal. In children, we know that children who have had anesthesia repeatedly before age 2, 3, or 4 have a greater likelihood of having a learning disability later in life. Now, does that learning disability impact their life outcome? Usually not.
Okay.
So I hope that answers the question.
That does, yeah. Your team has been working on a lot of different studies over time, and prospective studies about the effects of the brain development of children that have undergone anesthesia. Are you able to share some of those research studies and what they've shown?
Well, we have a research study. This is called the study is called the MASK study, and it should be published within the next month or two. And that study took a group of about 1,000 children and identified half of them who had an anesthetic and half of them who didn't have an anesthetic in the past, and brought them back to the Children's Center to have very extensive testing. Each one of these children had 4 hours of testing. Wow. And interestingly, Angie, they had the same intelligence test as the monkeys do. So the monkeys perform these tasks and they get rewarded with banana pellets, and the children get rewarded with nickels. Okay. And the children actually love doing this test. So that will allow us to compare how children perform and how the monkeys performed, and to look specifically at the particular tasks that they may or may not have difficulty with, to see if it's the same ones that the monkeys had difficulty with. I think I can't really provide the outcome of that study. It will be published, and we have to hold off until it's published.
So stay tuned.
Stay tuned. Yeah. But I can tell you it should be reassuring to parents.
Fantastic. Well, I'm looking forward to those results greatly. Yeah. As having a child who's had to undergo anesthesia and probably will in the future, and hopefully will be reassuring to some of our people that are watching as well. So to kind of answer the question, the question that the title of our topic for today, is anesthesia safe for children? The answer seems to be yes. Is that true?
Well, you asked the question about, is it safe from the perspective of brain development? And I think the answer to that increasingly seems to be yes. There may be some caveats there, but we'll see over time. The larger question of whether anesthesia is safe for your child, I think we can say yes to that question as well. One of the great stories of medicine is how anesthesia has revolutionized the ability to do surgery. So whenever you hear about a new surgery, remember that that surgery can only be done because anesthesia has become so safe. Once upon a time, anesthesia was so risky, people didn't want to have surgery because they were afraid of the safety of anesthesia. Now, that said, if we look at the difference in safety or the risk of anesthesia between adults and children, there still is a gap between the safety of anesthesia for children and adults. The younger the child, the more the risk. Now, yes, anesthesia is more risky, especially in infants and neonates, or what we call newborns or neonates. It's still very, very safe. And we actually studied that in children for 100,000 children we looked at here at Mayo Clinic, I guess 10 years ago, and looked at the likelihood of death under anesthesia in children. And we know that the risk of death in children has gone down dramatically over the last 20 years. So that risk is very, very low. Keep in mind that the risk goes up based on how sick the child is when they come for an anesthetic, or how complex the procedure is. Obviously, if you're having a heart surgery, then the risk is greater than having your tonsils out, for example.
What risks are you referring to? And I'm sure it really depends on what type of surgery and anesthesia is being performed. But
so risks of anesthesia run the spectrum. When I'm asked about risk, is it the risk of death? And that's often what parents want to know. Yeah. But there's a risk also of the need for admission to the hospital on an outpatient procedure. Or how often do children have problems with nausea and vomiting after surgery? So all those things are things that we look at as risks of anesthesia. Some of the things that reduce the risk of anesthesia are who's providing the anesthetic. Is a pediatric anesthesiologist providing that anesthetic? Is the anesthetic carried out in a setting like a children's hospital? And what are the resources that are available in a children's hospital? The resources are enormous. So if I need help caring for a child in the operating room, I can reach over and push a button and have every specialty and 100 people available to me at a moment's notice. If you're in the office, in an office-based setting, that won't happen.
Right.
So those are the kinds of things that you think about when you think about risk of anesthesia. It's not just who provides it, it's where it's provided, what the procedure is, those sorts of things.
So that is probably a question that parents should be asking about if their child's going to be undergoing a surgery or a procedure. Are there any other things that you would recommend parents ask prior to their child undergoing anesthesia?
You know, Angie, it's kind of who's providing the anesthetic,
Right.
what anesthetic are they providing? Are they providing sedation or general anesthesia, or are they doing local anesthetic, those sorts of things? Where? Is it done in an office-based setting? And this gets into what kind of procedures typically occur in the office-based setting, and that's usually dental anesthesia. What type of procedure is being done? In other words, is a procedure appropriate for the setting? If you're in a surgical center, for example, maybe that big procedure is not appropriate for a surgical center. Here at Mayo, we have very strict criteria about what can be done in our surgical center and what has to be done in the hospital. What can be done in an office-based setting, which we do very, very little of, as you know. So those are the kinds of questions that parents should ask, and that really depends on how old the child is. Young children, as I said, the risk of anesthesia goes up significantly, and those kids probably should be done in a hospital-based setting or in a surgical center where there are pediatric providers, pediatric anesthesiologists, and support available.
Okay. Those are great tips for them. You mentioned dental anesthesia in the office setting, and we actually have a patient question about this. This is something that's been in the news as well, a lot of topics about maybe some risk of death on children that have died in the dental office setting. And we won't comment on those specific cases, but what should parents know about dental anesthesia? What should they ask their dentist that may be providing this anesthesia to them?
So that gets back to what we just talked about.
Right.
So who's providing the anesthesia? This is the single most important question to ask. So is the same person providing the dental care as providing the anesthesia care? This is the fundamental issue that comes up when we talk about this, and that this has been a problem. In fact, there was a segment on NBC this summer, I think on Megyn Kelly or something like that addressed this issue. There have been an unfortunate number of children who have died in dental offices, one in Minnesota a couple of years ago, a teenager. And the problem comes down to, in most cases, is the person providing the anesthesia has difficulty, or the person providing the dental care has difficulty also monitoring the child. So there has to be a separate person who monitors the anesthesia, and that person must be qualified to do so. And often that's not the case. The second thing is, often when we look at these cases and understand what happened, there's what we call in anesthesia a failure to rescue. So everyone in anesthesia is used to having problems occur under anesthesia. That's part of what we do. And we have to be prepared and trained and have the right equipment and support to be able to rescue a child when those things occur. And so we try very hard to not have problems, but when they occur, we want to be able to very seamlessly deal with those problems and rescue that child. And unfortunately, in some of these settings, and the office-based setting, the capacity to rescue is not really there. So any child who's having anything other than a very simple procedure really probably ought not have that procedure in the office-based setting. Another important question for families to ask is, especially with regard to dental care, is does the child really need that procedure? So most children who get dental procedures probably don't need them, and there are non-surgical alternatives to that treatment. And by the way, most children who get dental care under anesthesia, young children who get dental care under anesthesia, have dental caries or extensive cavities that are being fixed under anesthesia. Most of those children probably don't need to have dental surgical care. They can have a simple outpatient painting of the teeth with a particular medication, and they wouldn't need to have that surgery.
Absolutely. Well, thank you for touching on that topic. Let's wrap up today by talking a little bit about the Children's Center here. You are the director and leading the health of children at Mayo Clinic. Tell us a little bit about what we have to offer here at Mayo Clinic Children's Center.
So many people think of Mayo Clinic as a place for adult patients.
Yeah.
They don't think of Mayo Clinic as a place for children.
Right.
But Mayo Clinic for children is very much like Mayo Clinic for adults. If you have a child who has a complicated problem or a problem that others have not been able to figure out, so to speak, if your child needs a complicated procedure, Mayo Clinic is a place to come. It's a real option for you and your family. I just left a little while ago taking care of a child who has a complex vascular malformation. Yesterday I took care of a child who is having a stem cell harvest to treat their very complex heart problem. So we do lots of innovative care of children with very complex problems or complex diagnoses. So we often get children who come from around the country who their parents have gone from one doctor to another trying to understand their illness, and they come to Mayo Clinic and we do the best we can and often are successful, better understanding and better helping the family manage that problem or sometimes fix the problem.
Yeah, it's been a pleasure to work here and having trained here and trained under you as well when you were the director of the Children's Hospital as well.
Yeah.
Well, thank you so much for joining us today and sharing your knowledge of this topic.
My pleasure. It's been fun.
It has been fun. We'll have to have you back again. There's much more to be talked about and to be said about this area and other areas.
Great.
Yeah.
Look forward to it.
Join us for the next Ask the Mayo Mom. It will be on March 22nd. Our guest will be Dr. Nupuni Rajapaksa, who is a pediatric infectious disease doctor. We will be discussing the important topic of prudent antibiotic prescribing, also known as antibiotic stewardship, and the risk of antibiotic resistance that we're seeing developing all around the world. Join the conversation for us at 11 a.m. Central Standard Time. Thank you, everyone who watched today and sent in questions. If we didn't get to them during the live broadcast, we'll be sure to get to them after. Thank you, and have a wonderful day.